Eye cancer refers to a group of cancers that start in different parts of the eye. It is rare but can occur in both adults and children. Eye cancer can either develop inside the eye intraocular or in the surrounding tissues extraocular. There are several types of eye cancer, with melanoma being the most common in adults, while retinoblastoma is the most common in children. Types of eye cancer: intraocular cancer inside the eye. Uveal melanoma, the most common primary eye cancer in adults. It develops in the uvea, the middle layer of the eye, which includes the iris-colored part ciliary body, and choroid. Retinoblastoma, the rare type of eye cancer that typically affects children under the age of 5. It starts in the retina, the light-sensitive tissue at the back of the eye. Intraocular lymphoma, the rare form of lymphoma, the type of blood cancer that affects the eyes, usually seen in adults with a weakened immune system. Extraocular cancer around the eye. Eyelid cancer, often a type of skin cancer, such as basal cell carcinoma, squamous cell carcinoma, or melanoma, that develops on the eyelid. Orbital cancer, this type affects the muscles, nerves, and other tissues around the eyeball, commonly spreading from nearby structures. Risk factors: different types of eye cancer have distinct risk factors. Uveal melanoma. Risk factors include light-colored eyes, fair skin, and excessive exposure to sunlight or UV light. It's also more common in adults over 50. Retinoblastoma. This is often due to a genetic mutation in the RD1 gene, which can be inherited or occur spontaneously. Eyelid cancer. Risk factors include sun exposure, fair skin, and age. Intraocular lymphoma. Having a weakened immune system, such as in people with HIV/AIDS or those taking immunosuppressive medications, increases the risk. Symptoms of eye cancer. Symptoms depend on the type and location of the cancer but may include blurry vision or vision loss in one eye, seeing flashes of light or floating spots floaters, a growing dark spot on the iris or inside the eye, change in the size or shape of the pupil, the dark circle in the center of the eye. Eye pain or discomfort, less common in some cancers, like melanoma. Redness or swelling of the eye. A white reflection in the pupil, particularly in children with retinoblastoma, noticeable in photos with flash. Diagnosis. To diagnose eye cancer, the doctor will perform a comprehensive eye exam and may order additional tests. Ophthalmoscopy. A detailed examination of the inside of the eye using an ophthalmoscope to check for abnormalities. Ultrasound of the eye. This imaging test uses sound waves to create pictures of the eye and detect tumors. Fluorescein angiography. A dye is injected into a vein, and photos are taken of the retina to detect any abnormalities. CT or MRI scans, to determine if the cancer has spread beyond the eye. Biopsy. In some cases, a small sample of tissue from the tumor may be taken and analyzed to confirm the diagnosis. For retinoblastoma, genetic testing may also be performed to check for mutations in the RD1 gene. Treatment options. The treatment for eye cancer depends on the type of cancer, its location, size, and whether it has spread. The main treatments include 1. Surgery. Enucleation, removal of the entire eye, usually done for large tumors or when vision cannot be preserved. Exenteration, removal of the eye and surrounding tissue, including muscles, eyelids, and nerves, in advanced cases where the tumor has spread outside the eye. Local resection. For smaller tumors, surgery may involve removing only the tumor while preserving the eye. 2. Radiation therapy. External beam radiation therapy delivers radiation from outside the body to destroy cancer cells. Brachytherapy. Platinum radiotherapy. Radioactive seeds are placed close to the tumor, commonly used in uveal melanoma. 3. Chemotherapy. Chemotherapy is often used for retinoblastoma and intraocular lymphoma. It can be given as systemic chemotherapy through the bloodstream or localized chemotherapy delivered directly to the eye. Intraarterial chemotherapy delivers chemotherapy directly to the eye through the blood vessels, often used in retinoblastoma. For laser therapy and cryotherapy. Laser therapy photocoagulation uses a laser to destroy the blood vessels feeding the tumor, sometimes used in small eye tumors. Cryotherapy freezes and kills cancer cells, often used for small retinoblastoma tumors. 5. Immunotherapy or targeted therapy. These newer treatments, which involve boosting the immune system to fight a cancer or targeting specific cancer-causing genes or proteins, may be used for advanced or recurrent cases of eye cancer. Prognosis. The prognosis for eye cancer depends on several factors, including type of cancer. Retinoblastoma in children generally has a very good prognosis, with a survival rate of over 95% if caught early. Uveal melanoma, however, can be more aggressive, especially if it spreads beyond the eye. Stage of cancer. If the cancer is localized within the eye, outcomes are better. Once it has spread and metastasized, particularly to the liver common in melanoma, the prognosis worsens. Location and size. Smaller, localized tumors are easier to treat and have a better prognosis. Treatment response. The cancer's response to initial treatment plays a significant role in long-term outcomes. Long-term follow-up. Patients treated for eye cancer need regular follow-up care, including monitoring for recurrence, regular eye exams and imaging tests to check for the return of cancer. Managing side effects. Depending on the treatment, patients may need prosthetics in cases of enucleation or vision aids. Checking for metastasis. Particularly in cases of melanoma, the liver and other organs need to be monitored for signs of metastasis. Conclusion. Eye cancer, though rare, can have significant effects on vision and overall health. Early detection and treatment are key to improving outcomes, especially in children with retinoblastoma. With advances in treatment, many forms of eye cancer can be effectively managed, preserving both life and vision when possible. Regular eye exams and awareness of symptoms can help in catching these cancers at an early stage, when treatment is most effective.